Welcome to the SNF Spotlight Series, brought to you by Renewal Rehab, a dynamic therapy company that provides full-service therapy for nursing homes. You'll be hearing from some of the leading nursing home professionals in the country, as well as many healthcare heroes that are sacrificing day in and day out to help your loved ones recover and come home to you.
Welcome to the SNF Spotlight Series, find out what's really going on in nursing homes. I'm your host, Yitz Rubin, and I'd like to thank the Renewal Rehab family for sponsoring this program. Renewal Rehab provides therapy for SNFs nationwide. Trust Renewal to renew your loved one and renew your home. Today I have the privilege to be speaking with Erik Iverson, the business growth strategist at BRIA Health Services. Erik, thank you so much for joining me. Can you tell me a bit about yourself and BRIA Health?
Sure. Thanks for having me. It's a little bit about myself. I've been doing kind of nursing homes for a little over a decade. Started from admissions coordinator, was working towards becoming an administrator. I was in an AIT program in a company called Manor Care, which is national. So I've got a lot of good training there, and worked my way up to hospital liaison, up to a regional director of business development, up to vice president of business development, ultimately to chief strategy officer for a large organization based out of Chicagoland. And it just started this year at BRIA Health Services as their business growth strategist. BRIA Healthcare's 11 facilities, really Illinois-based. We have one in Milwaukee, offering a kind of wide range of services from ventilator care to dialysis care to post-acute rehab to psychiatric care, long-term, short-term. I think the industry as it stands now, a network needs to offer specific clinical niches. I think this in this day and age, as acuity continues to rise, as occupancy levels are getting more and more difficult to keep up, companies have to innovate clinically, I think, to keep on track, and that's what BRIA really has done.
So is your goal more of keeping the 11 facilities full, or getting more facilities, or both?
Both, yeah. It's operators aren't going to grow unless their current portfolios are performing well. So I think, the initial charge is to make sure that we bring occupancy up in the facilities that we have now. Really, what I've always been strong with, in my career is bringing hospital systems and the nursing home together in a true partnership. I think what kind of the old school game was just send a liaison out there, give them some cupcakes, give them some flyers, hustle, which is a part of the game. You gotta hustle. But my sales cycle with a hospital partnership is a little longer, but ends up lasting longer because of some of the things that we're able to do.
Can you give us a little bit of the secret sauce, or because it sounds like there's a different style going on, or is that not something that you'd want to share with the world?
No, I can share. I'm a big believer that, especially in this day and age, nursing homes should be sharing as many secrets as possible. The secret sauce to me is transparency. I'll be honest. Hospitals want partners that are sharing the good and the bad, and to the point where you can't really be a salesman, when you're going to hospitals. They see right through it. It more so now than ever. If you're walking in there and you're sort of talking like, old school nursing home, it's gonna fall on deaf ears, to be honest with you.
Right. I feel myself being in sales. I feel like you should send me a bill after this.
There you go.
So you're saying, so right now you're dealing with 11 facilities, keeping them full and building those hospital relationships. What made you specifically, like with your experience, I've heard about you in the past, with your experience and your, your expertise, what made you go, what did you see in BRIA Health Services that said, hey, I would want to work with these people, I like what they're giving? Like, can you tell us a little bit about that?
Sure. Couple of answers to that. Who I work for is very important. The ownership here at BRIA is really full of honest and ethical people. So to me, that was number one. So that's really what it started. But BRIA as a product is unique in the fact that they've got a few of their facilities are these gorgeous, beautiful, what you would expect from sort of a premier post-acute partner, right? And that's awesome. That's easy to sell, But then the other part is, they have facilities that cater to all types of populations, and to me that was another important part. So yeah, to me again, it's who I work for, and which is a company that is ethical and honest and strong, and then it's why do I work for them, and how can I help, because I'm not, I would never want to take a position where I didn't think that I could help. So that's kind of why I landed at BRIA. Right.
It's good to know also from an employee standpoint of what someone with your talent and your expertise, what you would be looking for, and it could be like good for owners and CEOs to really understand that this is what's going to attract good talent, and this honesty and ethical is not just about the paycheck.
Right.
So now you're at BRIA. So what do you see that you're going to bring to the table? Like, obviously you're not looking, you have a vision in mind.
Yeah.
Somewhere that you want to take BRIA. So what would that be? What is
sure.
that in your 2 years?
Yeah. So for me, especially over the last few years, team building and sort of sales coaching has become something that I've become very passionate about. So what I will bring to BRIA is this sort of really coaching and mentoring mentality, because I think too often sales managers come in and either they want to be the guy who gets all the glory, and do all the sales and, hey, look at what I can do, or they want to sort of put a process in place and then walk away. What's that called? Like the watchman mentality, where it's like you build the watch and you wind it up and you let it go. I don't believe in either approach. I think you've got to, as a sales manager, you need to have a plan on how you're going to make your people better, and then you need to be a part of that plan. Nursing home companies or owners or whatever think that it's the hospital's responsibility to remember what they do. It's not, and they're not gonna, let's be honest. So the question is always, how can we be in front of them with the right message at the right time, without being annoying, with a message that is one to say, hey, we can help you. Don't forget about what we can do, and figuring out how to do that without being too salesy. So that's going to be my approach at BRIA.
Right. And do you feel like these sales approaches are constantly changing? Like, what I really like about you, I mean, we just met recently, but it's like I feel like you're so humble and real, and it's not like the standard sales approach. And like, do you feel like you have to keep being innovative with the sales approach, or is this like, hey, we have a standard way, let's just keep rolling with it?
There needs to be innovation, but like you said, I think people have to figure out also what works with their personality. I think that's the other thing that people think, well, if I follow this script and I say these words and I say it for this long and I that I'm going to make that sale, right? And I think the reason I sound natural is because I've spent so much time. I do a lot of it's cheesy as it sounds. I do a lot of talking in the mirror, or imagining how conversations will go, right? And to me, it's if you're not doing that, if you're walking in without sort of having these simulations, either in your mind or otherwise, it's always going to sound canned. It's always going to sound unnatural. And again, it's going to turn people off. So you better always know what your message is. You better have it memorized, and it better sound like it's not memorized.
So moving on to growing, potentially getting new homes and things, what would you be looking for in a new home, and how would someone approach you? How would that work?
Sure. I think the main thing is, can we make a difference in that market? When I'm looking at something, I want to walk in and say, can I make a difference here? Can I put a dialysis den in? And do I have a nephrology group that I can target where I can make a difference in that market? So to me, that kind of is the key to the area. And then the other part is, do they have the population? Some markets have failing nursing homes because either they're too rural or they're oversaturated, or so to me, looking at population trends is pretty important, because if you don't have enough people, or if you have an aging population that's moving away, or if you've got a young population that doesn't need nursing homes, you're going to be in trouble for years to come.
So it sounds like there's so many pieces involved. There's marketing, there's collateral, there's analytics, there's statistics. Do you do this all yourself, or you have a team that you hire?
You got to build a system. I mean, I think it depends. I consider myself more of a sales manager than a marketing manager, and I guess I'll tell you what I mean by the difference. I'm big into that customer face-to-face interaction, that sales portion of sales and marketing, where there's this whole other graphic design and branding, and I like to get involved in that only because it does serve the sales process, but to me they're different jobs, so I think you've got to make sure that you have that sales manager type, and then you've got to make sure that you've either got marketing support or a marketing manager that can help with that brand stuff, the website, the collateral, the SEO, the social media. That's huge. Not enough nursing homes do social media well, in my opinion. And as crazy and annoying as social media is, people use it. People are going to keep using it, and I think nursing homes who can figure out how to make that part of their business pop are better off.
Right. So what would you say if, let's say, is there a number to the budget? If, let's say, someone has a nursing home, what should their budget be for sales, marketing, both? How do they divvy that?
Yeah, I mean, it's really going to be dependent a lot at what they're currently running. When COVID first hit, I think a lot of companies said, "Do I need so many liaisons? Do I need so many salespeople?" That happened a lot. But I think now we're looking, people are like, "Shoot, I gotta get this census back. I'm gonna reinvest, in this, because 2021, right? We gotta all rock it. We gotta get back to sort of these pre-COVID numbers."
Eric, thank you so much for taking the time to speak with me today. It was a real honor and a privilege to meet with you, and I wish you a lot of success at BRIA, and hopefully do some work together.
Yeah, absolutely. No, appreciate it. I anytime I can talk about sort of the industry, and I get excited. I could talk to you for an hour, so I appreciate you reaching out.
Thank you for listening to the SNF Spotlight Series. Please subscribe to our channel as there will be many new and exciting episodes from our healthcare heroes.